Looking younger is something many women and men strive for each day. A popular procedure is Botox, and if you're considering Botox, consider this.
Anytime that you're dealing with the tissues around the eye, who better to deal with those tissues than an ophthalmologist or an eye doctor? If you're dealing with tissues around the eye, it would make sense that you'd have a qualified eye doctor to administer the treatments instead of a PA or a nurse.
Dr. Langley oversees all Botox cases at Eye Care Associates.
I see it providing two benefits to me. The first being, of course, I didn't take very good care of my skin in my 20s and early 30s. So now I'm looking for a way that I can keep myself looking younger and fight age every step of the way. Second, I heard that Botox had the potential of preventing me from getting headaches. I'm a lawyer. All day long I'm in front of the computer. I read, I research, and I write. With Botox, it prevents me from using those muscles. So it makes those muscles more relaxed, and it does keep me from getting headaches.
This is a great treatment here for patients who are chronically squinting to read, and will help decrease the stress on the muscles here and help decrease some headaches. So what the Botox medication will do is decrease the activity of those frontalis muscles and effectively relax the frontalis muscle, and these fine lines, all that will remain will be these fine lines here, which will begin to fade with time. It will effectively paralyze the muscle and allow it to not contract.
The Botox procedure is quick and easy.
Actually, it's quite painless. What we use is we can use a topical numbing cream to apply to the area, and if anything, it just feels like a tiny little stick, and it's over before you know it.
Even for Ariel, who's afraid of needles.
It's not painful. I don't feel it. I'm not afraid, and they walk me through it. They explain what they're doing, and puts me at ease. They come in and they look at my face and they see what I need, and they assure me that I'm not going to have that lack of expression look, or and they assure me that I'm not going to have that droopy eye. It's very gentle. It's like a pinprick. I really don't even feel it.
But in a few days, she and others will see the difference.
Onset of action is between 2 and 7 days. However, Botox usually achieves its maximal effectiveness at about 2 weeks.
In a few minutes, see the results of Ariel's Botox. It's been a week since Ariel had her Botox procedure. This is what she looked like before.
You can see that when she wrinkles her forehead up, she has all these hyperdynamic folds in her skin.
And here is what Ariel looks like 1 week later.
On Ariel, what we like to try to do is we like to try to leave a little bit of a brow lift, which gives her a natural arch, which gives her some facial expression.
I'm really happy with the results. I feel like I look younger, and I know that I'm taking proactive action to prevent wrinkles in the future, first and foremost. I still have expression, and I just feel like my face looks smoother.
Ariel works closely with Dr. Langley to determine how many Botox treatments she should get and where to get those treatments. That's something Eye Care Associates offers every patient.
Some patients' concerns are looking false or fake. One of the ways that we help reduce that is by precise and individualized patient care and selection. What we'll do is we'll strategically place the medication in areas that will maximize the patient's desired effects.
They create an individual plan for each patient.
And Botox treatments are safe and effective with minimal side effects. The patient should be able to return to work with minimal delay. The treatments are very quick and rapid.
And virtually painless.
Me, of all people who am scared to death of needles, if I don't have a problem with it, then nobody's going to have a problem with it. I intend to fight age every step of the way.
And she intends to have Dr. Langley handle the procedure. That's why Ariel chose Eye Care Associates.
Facial musculature is actually very complicated. There are many muscles in the face, and they are intricately involved with each other. So I think it's extremely important that the physician who is administering the treatment should be very familiar with facial anatomy. As I am a board-certified ophthalmologist, I will actually be personally giving the administrations, and it won't be one of my nurses or one of my PAs. So I personally oversee the Botox treatments when I work one-on-one with the patient.
If you're considering Botox, schedule a consultation today.